If you are over the age of 65, there is something important many people never hear before their next medical appointment. Sometimes the real cause of confusion, memory problems, or sudden mental fog is not simply aging. And in many situations, it is not something happening inside the brain at all. Instead, the source may be sitting quietly in a small bottle in your medicine cabinet. A medication. Prescribed with good intentions, approved and commonly used, yet capable of slowly affecting how the brain functions over time, especially in adults over 65. Most people never connect the two. They assume the changes they feel are simply part of getting older. But the connection between certain medications and cognitive changes is something researchers have been studying carefully for years. Let me tell you about a woman I once met. Her name was Margaret. She was 72 years old, a retired school librarian living outside Columbus, Ohio. When she arrived at my office, she carried a canvas bag filled with prescription bottles. She placed them on the desk one by one. By the time she finished counting, there were 11. Then she looked at me and said something I have never forgotten. "I take all of these every day, and lately my mind feels different. Something isn't right." She described losing words in the middle of sentences, forgetting conversations from earlier that same day, feeling as if her thoughts were moving through a thick fog. At first, she assumed it was simply aging, but her intuition told her something else might be happening. And in many cases like Margaret's, that instinct turns out to be correct. Large, long-term studies following thousands of adults over 65 have shown something surprising. When multiple medications with certain neurological effects accumulate over time, the combined burden may influence how the brain processes memory and attention. Researchers sometimes refer to this as medication burden. And one of the most important biological systems involved in this process revolves around a single brain chemical, acetylcholine. Acetylcholine is one of the key messengers your brain uses to form memories, maintain attention, and keep mental processing sharp. Think of it as part of the communication network inside the brain. Messages travel between cells using this signal. But after about age 60, the brain naturally begins producing less of it. That means the system is already operating with smaller reserves. When certain medications also interfere with acetylcholine signaling, the combined effect can sometimes resemble early cognitive decline. This is why scientists often refer to something called the acetylcholine burden. It does not mean the medication is harmful for everyone. It means that in older adults with lower reserves, the brain may respond differently than it would in younger people. Today, I want to walk you through several medication categories researchers frequently discuss when studying cognitive health in adults over 65. This information is not meant to replace your doctor's advice, and it is never a reason to stop a medication on your own. Instead, the goal is simple: understanding. Because when you understand how medications interact with the aging brain, you can ask better questions during your next medical visit. And those conversations can sometimes make a meaningful difference. Before we continue, there is something important to remember. Most medications exist because they provide real benefits. Many of them improve quality of life. Many help control serious health conditions. But as we age, the body processes medications differently. Kidneys filter more slowly, liver metabolism changes, and the brain itself becomes more sensitive to certain chemical signals. This is why the same medication that feels completely normal at age 40 may feel very different at age 70. Now let's begin with something many people assume is completely harmless: over-the-counter sleep aids. Let's start with something millions of older adults use without thinking twice about it: over-the-counter sleep aids. Many people assume that if something can be purchased without a prescription, it must be harmless. But research over the past decade has shown that this assumption is not always correct, especially for adults over the age of 65. The most common ingredient in many nighttime sleep aids is a substance called diphenhydramine. You may recognize it from allergy medications or products labeled with words like PM, nighttime, or sleep support. For younger adults, occasional use may simply cause temporary drowsiness. But in older adults, the story can be different. Diphenhydramine works by blocking histamine in the brain, which produces the sedating effect people rely on to fall asleep. However, it also blocks acetylcholine receptors, And as we discussed earlier, acetylcholine plays a critical role in memory and mental clarity. When this signal is interrupted night after night for long periods of time, the brain's communication system can become less efficient. Researchers studying thousands of adults over 65 have observed that long-term use of medications with strong anticholinergic effects is associated with measurable changes in memory and cognitive performance. The effect is not immediate, it builds gradually. Many people begin noticing subtle changes, forgetting where they placed everyday items, struggling to recall a familiar word, walking into a room and forgetting the reason they came there. These small moments often get dismissed as normal aging, but sometimes the explanation may be more complex. The brain's chemical signaling system is simply being interrupted too often. Now, here is something important. Occasional use of a medication like this does not necessarily create long-term problems. The issue researchers are studying is regular use over months or years. When the same chemical signal is blocked night after night, the brain must constantly adapt. For some individuals, this adaptation can lead to slower processing and reduced mental clarity. Fortunately, many physicians today recommend alternatives that are considered gentler for older adults. Certain non-sedating allergy medications do not cross into the brain as easily, and behavioral sleep strategies, such as improving nighttime routines or adjusting light exposure, can sometimes provide similar benefits without affecting brain chemistry. Now let's move to another category that surprises many people: medications used to treat acid reflux. Proton pump inhibitors. You may recognize names like omeprazole, pantoprazole, or esomeprazole. These medications are widely prescribed and often very effective at reducing stomach acid and relieving discomfort. But researchers studying long-term use discovered something interesting. Stomach acid plays an important role in absorbing several nutrients the brain depends on. One of the most important is vitamin B12. Vitamin B12 supports the protective insulation around nerve fibers. Think of it like the protective coating around electrical wiring. Without enough of it, signals traveling through the nervous system can become less efficient. If stomach acid is suppressed for many years, the body may absorb less B12 from food. For some people, this can slowly reduce levels over time. Low B12 levels are known to influence memory, concentration, and mental energy. This does not mean these medications should never be used. For many individuals, they provide important relief and protection, but it does mean that long-term use should sometimes be monitored carefully. Many physicians now recommend checking B12 levels periodically for patients who have used these medications for extended periods. Small adjustments like monitoring nutrient levels can help prevent potential problems before they appear. Next on the list is a medication category that affects a very different part of the body, but the brain can still feel the effects. Medications used for overactive bladder. One example is oxybutynin. These medications work by relaxing bladder muscles and reducing sudden urges to urinate. For many people, this can greatly improve daily comfort and confidence. But the way these medications work involves blocking certain nerve signals that control muscle activity, and those signals also rely on acetylcholine. In other words, the medication cannot easily distinguish between signals in the bladder and signals in the brain. When the brain already has reduced acetylcholine reserves due to aging, blocking these signals further may sometimes affect memory or concentration. Researchers studying older adults have observed that long-term exposure to strong anticholinergic medications is associated with higher rates of cognitive decline. Again, this does not mean the medication is wrong for everyone. It means doctors today often evaluate alternative treatments that may work through different pathways. Newer medications have been developed that relax the bladder without interfering with acetylcholine signaling in the brain. This is an example of how medical understanding continues to evolve. What worked decades ago may now have improved alternatives. Now let's talk about another category that often raises questions: statins. These medications are widely used to manage cholesterol levels and reduce cardiovascular risk. For many people with heart disease risk factors, they provide significant protection. But scientists have also explored how different statins interact with the brain. One key difference lies in whether the medication easily crosses the blood-brain barrier. Some statins are more fat-soluble, which means they can enter brain tissue more easily. Others remain more concentrated in the bloodstream and liver. Researchers studying cognitive outcomes notice that this difference may matter. Certain statins appear less likely to influence brain chemistry simply because they do not enter the brain as easily. This is why medication choice sometimes matters as much as medication class. Two medications may treat the same condition but interact differently with the brain. For many patients, simply adjusting which medication is used can maintain the intended benefit while reducing unwanted effects. Now let's talk about a medication category that doctors usually prescribe for very understandable reasons. Medications for anxiety and sleep, known as benzodiazepines. You may recognize names like lorazepam, diazepam, alprazolam, or clonazepam. These medications can be very effective in the short term. They calm the nervous system quickly and can provide relief during periods of intense stress or severe insomnia. But the key phrase here is short term. The brain uses a natural calming chemical called GABA to regulate stress signals. Think of it like the braking system for the nervous system. When something stressful happens, GABA helps slow things down and restore balance. Benzodiazepines work by amplifying that signal. Initially, this can feel very helpful. Sleep improves, anxiety quiets down. But when these medications are used for long periods of time, the brain gradually adapts. It begins producing less of its own natural calming signals because the medication is doing the work. Over time, the nervous system becomes dependent on that outside signal. For some older adults, this adaptation may lead to slower reaction times, reduced alertness, and changes in memory processing. Researchers following large groups of adults over many years have observed that long-term exposure to these medications is associated with increased risk of cognitive decline. One important reason is that benzodiazepines slow down activity in parts of the brain responsible for forming new memories. If that slowing effect happens occasionally, the brain can easily recover. But if it happens continuously for years, the brain's normal signaling patterns may begin to change. This is why many specialists today recommend using these medications for limited periods whenever possible. Other approaches, such as sleep therapy, relaxation training, and certain non-sedating medications, can sometimes provide similar benefits without affecting memory systems in the same way. Next, we need to discuss a medication that has been around for decades: amitriptyline. Originally introduced as an antidepressant many years ago, it is now frequently prescribed at low doses for nerve pain, migraines, and sleep problems. Many physicians view it as a familiar and reliable medication. However, amitriptyline has one characteristic that researchers pay close attention to. It carries a strong anticholinergic effect. That means it interferes with acetylcholine signaling. And as we discussed earlier, acetylcholine is one of the most important neurotransmitters involved in memory formation and mental clarity. When scientists examine medication burden scales used in geriatric medicine, amitriptyline often ranks among the highest contributors. For some older adults taking it over many years, this effect can slowly influence cognitive performance. The changes are often subtle at first: searching for words during conversation, trouble recalling familiar names, difficulty following complex discussions. Because these symptoms develop gradually, they are frequently mistaken for normal aging. But in some cases, adjusting the medication can lead to noticeable improvement. Newer treatments for nerve pain and depression are now available that do not interfere with acetylcholine in the same way. This is why many geriatric specialists now review long-term prescriptions carefully to determine whether safer alternatives exist. Another medication worth discussing belongs to the class of antidepressants called SSRIs. Most of these medications are widely considered safe for older adults, but there is one exception that researchers have examined closely: paroxetine. Unlike other medications in the same class, paroxetine has measurable anticholinergic activity. In other words, it can influence the same brain chemical involved in memory signaling. Other SSRIs, such as sertraline or escitalopram, generally have minimal effects on acetylcholine. That difference may sound small, but in the aging brain, it can become important. When scientists compared cognitive outcomes among older adults using different SSRIs, those taking paroxetine showed slightly higher rates of memory-related symptoms compared with those using alternatives. Because other medications in the same category are available, many physicians today choose options with lower anticholinergic burden when treating patients over 65. Again, the key message is not that these medications are harmful in every case. It is that medication choice matters. Two drugs may treat the same condition, but influence the brain very differently. Now we come to a category of medications that carries one of the strongest warnings in geriatric medicine: antipsychotic medications. These include drugs such as quetiapine, risperidone, and olanzapine. They are extremely valuable for certain psychiatric conditions and can stabilize severe symptoms when used appropriately. However, in older adults without those conditions, they are sometimes used to manage agitation, sleep problems, or behavioral symptoms. And this is where careful evaluation becomes important. These medications affect dopamine signaling in the brain. Dopamine plays a critical role in motivation, attention, and decision-making. When dopamine activity is strongly suppressed, cognitive processing can slow down. Researchers studying long-term care facilities have observed that older adults receiving these medications without a clear psychiatric diagnosis may experience faster declines in memory and executive function. Because of this, medical guidelines now emphasize using these medications only when absolutely necessary and when other approaches have not worked. In many situations, non-medication strategies such as environmental adjustments, improved sleep routines, or behavioral support can be just as effective. But there is one more factor that may be even more important than any single medication, and it is something most people never think about: the combination of multiple medications. Now we come to the factor that often matters more than any single medication: the combination of multiple medications taken at the same time. In medicine, this is called polypharmacy. For many adults over 65, taking several medications is completely normal. One prescription for blood pressure, another for cholesterol, something for sleep, something for digestion, something for pain. Individually, each medication may make perfect sense. But when several medications that influence the same brain chemistry are combined, the effects can accumulate. Think of it like dimming the lights in a room. Turning the switch down slightly once may barely be noticeable, but if several switches are lowered at the same time, the room eventually becomes much darker. This is what researchers refer to as cumulative medication burden. And when that burden specifically affects acetylcholine signaling, scientists sometimes describe it as an anticholinergic load. Each medication may contribute a small amount, but together they can significantly affect how the brain processes memory and attention. This was exactly what was happening with Margaret, the woman who brought the bag of medication bottles to my office. When we carefully reviewed her list, we discovered something important. Several of the medications were affecting acetylcholine in small ways. One medication for sleep, another for bladder symptoms, another for nerve pain. Individually, each prescription seemed reasonable, but together they created a combined burden that was far higher than any single medication alone. Research following thousands of older adults has shown that when 3 or more medications with anticholinergic properties are taken together, the effect on cognitive function becomes much stronger than expected. In other words, the interaction is not simply additive, it can be multiplicative. This is why medication reviews are so important, especially for adults over 65. Many physicians now recommend periodic medication reviews where every prescription, over-the-counter drug, and supplement is evaluated together, not separately, together. Sometimes the solution is surprisingly simple. One medication may no longer be necessary. Another may have a safer alternative, or 2 medications may be performing the same function without anyone realizing it. In Margaret's case, we worked with her primary physician and pharmacist to gradually simplify her medication list. 3 medications were discontinued. 2 others were replaced with alternatives that had lower anticholinergic effects. The process was slow and carefully supervised, but the change was remarkable. 3 months later, she returned for follow-up. This time, she carried only one small prescription bottle. She placed it on the desk, smiled, and said something I will always remember. "I feel like my mind came back." Her memory tests improved, her concentration returned, and most importantly, she felt like herself again. Stories like Margaret's remind us of something extremely important. Cognitive changes are not always inevitable. Sometimes the brain is simply responding to chemical signals that can be adjusted, and understanding those signals gives you the power to ask better questions. So here is something simple you can do before your next medical appointment. Write down every medication you take, every prescription, every over-the-counter drug, every supplement. Bring the complete list with you. Then ask your doctor or pharmacist one simple question. Do any of these medications affect acetylcholine or cognitive function when combined? That conversation alone can sometimes uncover things no one noticed before. Because modern medicine is incredibly powerful, but it also becomes complex when multiple specialists prescribe medications independently. Your pharmacist, your primary physician, and your specialists all see different parts of the picture. Bringing the full list together allows them to see the whole story, and that is often where the most important insights appear. Your brain remains one of the most remarkable systems in the human body. It adapts, it repairs, it responds to the environment around it. Understanding how medications interact with that system is one of the most empowering steps anyone over 65 can take. Not out of fear, but out of awareness. Because awareness leads to better conversations. Better conversations lead to better decisions, and better decisions can help protect the clarity and independence that matter so much as we grow older. Thank you for spending this time with me today. If you found this information helpful, consider sharing it with someone in your life over 65 who may benefit from understanding their medications a little more clearly. And if you would like more research-based explanations about health, aging, and how the body really works, subscribe to the channel so you don't miss future videos. Take care of yourself, and I'll see you in the next video.